Welcome to 41 Today Lifestyle, everyone. I'm Troy Thompson. Joining me today is Dr. Sklyar from a Georgia Cancer Specialist. Welcome to the show, my friend.
Good morning.
Okay, so what we're going to talk about today is just a general conversation when it comes to cancer. But before we get into digging a little bit deeper, there are people out there that have not known anyone who has had cancer or in their immediate family. So let's just break it down a little bit if we can, Dr. Sklyar. What is cancer screening to begin with?
Cancer screening means testing that checks for cancer when someone doesn't have any signs or symptoms of cancer. The reason to do cancer screening is to find cancer at early stages when it's still curable.
Okay, well, what types of tests are used for cancer screening?
Right now we have 4 tests available and approved for cancer screening, which is mammogram for breast cancer, CT scan for lung cancer, colonoscopy or stool testing for colon cancer, and pap smear for cervical cancer. These are standards testing that is recommended for general populations, means someone who has average risk of cancer. But sometimes we use additional testing such as ultrasound, there is MRI or certain types of blood tests.
Okay, well, now you just said blood tests. Let's just talk a little bit about the liquid biopsy, which is a blood test. Is that correct?
Yes, it's a blood test that checks for cancer in your blood. So the idea is that cancer releases certain protein and genetic material into your blood, and that's something that can be tested to pick up cancer at early stages. And many tests are developed and now in trials. But one trial I want to talk about that was just reported recently, it had 10,000 participants with no known history of cancer, and they had all of them have this blood test. If test was positive, then PET scan, which is our special cancer scan, was done, and then the biopsy. So this way they were able to pick up 26 patients with cancer, and among them there was some cancers such as kidney cancer, ovarian cancer, for which we don't really have a screening available. So this is all very exciting. But of course, before it can be submitted to FDA and go actually to the clinics, more testing needs to be done on larger trial. So it's still a few years away.
Wow, that's amazing. Amazing, especially if people had no history or family history of cancer, right?
That's right.
This is very promising. I love to hear stories like this. Well, how do I know what type of screening is best for me? And I'm thinking, you know, for someone whose father just recently died of colon cancer, I didn't know that there was a stool screening. I just went straight in and had a colonoscopy.
Mm-hmm. Well, current screening schedule for average risk population, I repeat, for someone who doesn't have any family history or increased at risk of cancer for any other reasons, the general schedule is to start colonoscopy or stool testing at age 45, mammogram at age 40, CT scan for lung cancer screening at age 55, and pap smear at age 21. If you do have a family history positive for cancer, then you might need to start screening much earlier. For example, for colon cancer, the screening starts 10 years before your family member developed cancer. For certain genetic syndromes, this colon cancer screening needs to start as early as age 10, for example. But it's all based on what type of family history do you have and other risk factors.
Well, Dr. Sklyar, as always, you give incredible information. We really appreciate you. If you want to find out more, there it all is up on the screen. Give Dr. Sklyar a call or all the rest of her team from Georgia Cancer Specialist. We appreciate everything you do. Back after this short break.